Question 1. The review process indicates that a consultant is observing a dog exhibiting reactivity towards other dogs in a park. Which data collection method in this natural setting would best align with best practices for objective assessment and ethical observation? Option A. Actively encouraging the dog to interact with other dogs to better observe and document the reactive behaviors. Option B. Counting only the number of barks the dog emits when another dog is present, without noting the context or duration of barking. Option C. Systematically recording the frequency, duration, and latency of the dog's reactive behaviors, along with detailed notes on environmental triggers and the distance to other dogs, while minimizing direct interaction. Option D. Relying on the owner's subjective descriptions of the dog's emotional state during encounters, and only noting when the dog appears stressed. Correct answer is C. Systematically recording the frequency, duration, and latency of the dog's reactive behaviors, along with detailed notes on environmental triggers and the distance to other dogs, while minimizing direct interaction. Explanation. Scenario analysis. This scenario presents a common challenge in animal behavior consulting, balancing the need for objective, detailed data collection with the inherent variability and potential for observer bias in naturalistic settings. The consultant must ensure the data gathered is reliable and valid for informing behavior modification plans, while also acknowledging the limitations of observing animals in their everyday environments. Ethical considerations regarding animal welfare and minimizing disturbance during observation are paramount. Correct approach analysis. The approach that prioritizes systematic, objective recording of observable behaviors, including frequency, duration, and latency, while also noting contextual factors e.g., presence of other animals, environmental stimuli, time of day, represents best professional practice. This aligns with the ethical guidelines of the International Association of Animal Behavior Consultants, IAC, which emphasize evidence-based practice and the importance of accurate, unbiased data. Such a method allows for a thorough understanding of the behavior's patterns and triggers, leading to more effective and humane intervention strategies. It minimizes subjective interpretation and maximizes the potential for replication and inter-observer reliability, crucial for scientific rigor in behavior consulting. Incorrect approach is analysis, an approach that relies solely on anecdotal observations and subjective interpretations of the animal's emotional state, e.g., the dog seemed sad, fails to meet the standards of objective data collection. This introduces significant observer bias and makes it difficult to identify specific behavioral patterns or triggers, potentially leading to misdiagnosis and ineffective interventions. Ethically, it can result in misinterpreting an animal's needs, leading to inappropriate or even harmful management strategies. An approach that focuses only on the frequency of a behavior without considering its duration, intensity, or the surrounding context, e.g., only counting how many times a dog barks, provides an incomplete picture. While frequency is a component of data collection, omitting other crucial metrics limits the consultant's ability to understand the full scope of the behavior and its impact. This can lead to interventions that only partially address the problem or fail to consider underlying causes. An approach that involves extensive human interaction and manipulation of the environment during observation, e.g., constantly trying to elicit the behavior to record it, can alter the very behavior being studied. This violates the principle of observing the animal in its natural setting and can lead to data that is not representative of the animal's typical behavior. It also raises ethical concerns about causing undue stress or discomfort to the animal for the sake of data collection. Professional reasoning. Professionals should approach data collection in natural settings by first clearly defining the target behaviors to be observed. They should then select appropriate, objective measurement methods, e.g., scan sampling, behavioral mapping, event recording, that are suited to the behavior and the environment. Training for consistency in observation and recording is essential. Regular review of collected data, considering potential biases and limitations, and seeking peer consultation when necessary, are vital steps in ensuring the integrity of the assessment and the effectiveness of subsequent interventions. The primary ethical imperative is to gather data in a manner that is least intrusive and most informative for the animal's welfare. Question 2. The analysis reveals that a client's dog, a breed known for its strong prey drive, consistently exhibits a rapid, unlearned sequence of chasing and pouncing when presented with a small, fast-moving object, regardless of prior training or reinforcement history. This behavior persists even when the object is only partially visible or moves in a slightly atypical manner. The consultant is tasked with evaluating this behavior to inform a management and modification plan. Which of the following best describes the likely underlying mechanism of this behavior and its implications for intervention? Option A. The behavior is a fixed action pattern, triggered by a specific sign stimulus, the fast-moving object, suggesting that management strategies focusing on preventing exposure to such stimuli and redirecting the dog's energy are more appropriate than attempting to suppress the innate drive. Option B. The behavior is a learned response that has been inadvertently reinforced by the dog's owner, indicating that extinction protocols and positive reinforcement for alternative behaviors are the primary methods for modification. Option C. The behavior is a generalized anxiety response to novel stimuli, requiring desensitization and counter-conditioning techniques to reduce the dog's overall stress levels. Option D. The behavior is a form of attention-seeking, where the dog has learned that this specific action elicits a strong reaction from the owner, necessitating clear communication of boundaries and redirection to desired behaviors. The correct answer is A. The behavior is a fixed action pattern, triggered by a specific sign stimulus, the fast-moving object, suggesting that management strategies focusing on preventing exposure to such stimuli and redirecting the dog's energy are more appropriate than attempting to suppress the innate drive. Explanation. The analysis reveals a common challenge in animal behavior consulting, distinguishing between innate, instinctual behaviors and those that are learned or modified by experience. This distinction is crucial for developing effective behavior modification plans. A fixed action pattern, FAP, is a stereotyped, innate sequence of behaviors triggered by a specific stimulus, known as a sign stimulus or releaser. Misidentifying an FAP can lead to ineffective or even detrimental interventions, as attempts to suppress or modify an innate drive may be futile or cause undue stress. The correct approach involves a thorough observation and assessment process that considers the context, triggers, and consistency of the behavior. It requires understanding the species-specific ethogram and recognizing the characteristics of FAPs, such as their universality within a species, their performance even when the stimulus is incomplete, and their resistance to modification. This aligns with best practices in animal behavior consulting, emphasizing evidence-based assessment and intervention, and adhering to the ethical guidelines of the International Association of Animal Behavior Consultants, IABC, which prioritize the welfare of the animal and the effectiveness of interventions. Incorrect approaches often stem from a superficial understanding of behavior or a tendency to anthropomorphize. For instance, assuming a behavior is purely learned and attempting to extinguish it without considering potential innate components can lead to frustration for both the animal and the owner. This fails to meet the IABC ethical standards by potentially causing distress and not employing the most appropriate and effective methods. Another failure would be to oversimplify the behavior by attributing it solely to a sign stimulus without considering the broader environmental or social context that might influence its expression or intensity. This lacks the depth of analysis required for professional practice and can lead to misdiagnosis and ineffective treatment plans. Professional decision-making in such situations requires a systematic approach. 1. Detailed observation and data collection, documenting the behavior, its triggers, the environment, and the animal's response. 2. Literature review and ethological knowledge, consulting species-specific research on FAPs and relevant sign stimuli. 3. Differential diagnosis, considering all possible explanations for the behavior, including innate predispositions, learned associations, and environmental influences. 4. Hypothesis testing, designing interventions that specifically address the hypothesized underlying cause and monitoring the results to refine the plan. 5. Ethical considerations, prioritizing the animal's welfare and ensuring interventions are humane and effective. Question 3. The control framework reveals that when assessing a situation involving two dogs exhibiting escalating vocalizations and stiff body language during shared meal times, which approach best addresses the underlying social dynamics and promotes a positive resolution. Option A. Implement a feeding schedule that separates the dogs entirely and provides each with their own designated feeding area, while observing their general interactions outside of meal times. Option B. Focus on desensitization techniques to reduce the dog's reactivity to the sound of kibble being poured, assuming the vocalizations are solely a learned response to a specific auditory cue. Option C. Advise the owner to simply ignore the vocalizations and stiffening, believing that the dogs will eventually learn to self-regulate their behavior without intervention. Option D. Conduct a thorough observation of the dog's interactions during feeding, noting subtle body language cues such as lip licking, yawning, ear position, tail carriage, and proximity to each other, to understand the social hierarchy and resource-guarding tendencies. The correct answer is A. Implement a feeding schedule that separates the dogs entirely and provides each with their own designated feeding area, while observing their general interactions outside of meal times. Explanation. The control framework reveals that understanding social behaviors in animals is paramount for effective behavior consulting, particularly when addressing interanimal aggression or affiliative behaviors within a household or group. This scenario is professionally challenging because it requires the consultant to move beyond simply identifying a behavior to understanding its underlying social function and the complex dynamics at play. Misinterpreting social cues can lead to ineffective or even harmful interventions, potentially exacerbating the problem or creating new ones. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the social environment and the animal's interactions. This involves detailed observation of body language, vocalizations, and spatial relationships during various social contexts. It acknowledges that behaviors are rarely isolated events, but are part of a larger social tapestry. This aligns with the IOPT ethical guidelines, which emphasize evidence-based practices and a holistic understanding of animal behavior, ensuring interventions are tailored to the specific social structure and individual needs of the animals involved, thereby promoting welfare and reducing stress. An incorrect approach that focuses solely on the overt behavior without considering its social context fails to address the root cause. This could lead to interventions that suppress symptoms rather than resolving the underlying social dynamic, potentially causing distress or displacement behaviors. Ethically, this is a failure to provide competent service as it lacks depth and thoroughness. Another incorrect approach that relies on anecdotal evidence or popular, unverified training methods ignores the scientific basis of animal behavior. This can result in interventions that are not only ineffective, but also potentially detrimental, causing fear, anxiety, or aggression due to a misunderstanding of how animals learn and interact socially. This violates the principle of using science-based methods and could lead to animal suffering, a direct contravention of ethical standards. A third incorrect approach that involves generalizing behaviors across species without considering species-specific social structures is also professionally unsound. While some social principles may be universal, the nuances of social communication and interaction vary significantly. Applying generalized solutions without species-specific knowledge can lead to misinterpretations and inappropriate interventions, failing to meet the professional standard of care. The professional decision-making process for similar situations should involve a systematic approach. 1. Gather comprehensive history from the client, focusing on the context of the behaviors. 2. Conduct direct, detailed observations of the animals interacting in their natural environment, noting all relevant social cues. 3. Analyze the observed behaviors within the framework of known social ethology for the species involved. 4. Develop a behavior modification plan that addresses the underlying social dynamics and promotes positive interactions based on scientific principles. 5. Monitor progress and adjust the plan as needed, always prioritizing the welfare of the animals. Question 4. Quality control measures reveal that a significant number of behavior modification plans submitted by consultants for review are based on an incomplete understanding of whether a target behavior in a domestic dog is primarily driven by instinctual predispositions or learned associations. A consultant is presented with a case involving a dog exhibiting excessive vocalization when left alone. The consultant's initial assessment focuses on identifying the specific triggers for the vocalization and the consequences that follow. Which of the following approaches best reflects a comprehensive understanding of innate versus learned behaviors in this context? Option A. Recommending that the owner confine the dog to a crate for extended periods, believing that the vocalization is an innate territorial response that cannot be modified. Option B. Relying on online forums and anecdotal advice from other dog owners to determine if the vocalization is a common learned behavior for dogs left alone. Option C. Investigating the dog's breed-specific tendencies for vocalization and exploring the potential for separation anxiety as an innate predisposition, while also assessing the learning history related to owner departures and arrivals to understand learned associations. Option D. Immediately implementing a desensitization and counter-conditioning protocol for owner departures, assuming the vocalization is solely a learned response to the absence of the owner. Correct answer is C. Investigating the dog's breed-specific tendencies for vocalization and exploring the potential for separation anxiety as an innate predisposition, while also assessing the learning history related to owner departures and arrivals to understand learned associations. Explanation. Scenario analysis. This scenario presents a common challenge in animal behavior consulting where distinguishing between innate predispositions and learned responses is crucial for effective intervention. Misinterpreting the origin of a behavior can lead to ineffective or even detrimental training strategies, potentially causing client frustration, behavioral escalation, and compromising the animal's welfare. The challenge lies in the subtle interplay between instinct and experience, requiring a nuanced understanding of ethology and learning theory. Correct approach analysis. The correct approach emphasizes a systematic, evidence-based assessment that prioritizes observation and data collection to differentiate between innate and learned components of the behavior. This aligns with the IOP commitment to science-based practices and ethical client care. By considering the animal's species-specific behaviors, developmental stage, and environmental history, a consultant can build a comprehensive picture. This approach ensures interventions are tailored to the root cause of the behavior, promoting positive outcomes and adhering to the IOP ethical guidelines, which advocate for understanding the animal's natural behaviors and avoiding anthropomorphism. Incorrect approaches analysis. One incorrect approach involves immediately attributing the behavior solely to a learned response without considering innate factors. This fails to acknowledge the biological underpinnings of behavior and can lead to overlooking crucial instinctual drives that may be contributing to or triggering the observed actions. Ethically, this is problematic as it may result in training methods that suppress natural behaviors rather than managing them appropriately, potentially causing distress. Another incorrect approach is to assume the behavior is entirely innate and therefore unchangeable. This dismisses the significant role of learning and environmental influence in shaping behavior. It is ethically unsound as it can lead to a client abandoning the animal or accepting a suboptimal quality of life for both the animal and the owner, failing to explore potential management or modification strategies. A third incorrect approach is to rely solely on anecdotal evidence or popular opinion without a structured assessment. This lacks scientific rigor and can lead to misdiagnosis and ineffective interventions. It violates the IOP emphasis on evidence-based practice and can result in harm to the animal or client dissatisfaction due to poor outcomes. Professional reasoning. Professionals should approach such situations by first conducting a thorough history intake, followed by direct observation of the animal in its natural environment. They should then research species-typical behaviors and developmental milestones. Based on this comprehensive data, they can formulate hypotheses about the behavioral origins and design an intervention plan that addresses both innate predispositions and learned components. This systematic process ensures ethical practice, client satisfaction, and optimal animal welfare. Question 5. During the evaluation of a domestic cat exhibiting increased vocalization and avoidance behaviors, which approach to understanding its communication methods would be most aligned with best practices for an animal behavior consultant? Option A. Assuming the cat is simply seeking more attention and responding with increased verbal reassurance and physical affection. Option B. Focusing on interpreting the cat's vocalizations and body language through the lens of established feline ethology, considering individual variations and environmental context. Option C. Interpreting the cat's behaviors as a direct translation of human emotional states, such as sadness or frustration. Option D. Relying on anecdotal evidence from online forums about common cat behaviors without specific observation of the individual animal. Correct answer is B. Focusing on interpreting the cat's vocalizations and body language through the lens of established feline ethology, considering individual variations and environmental context. Explanation. This scenario is professionally challenging because it requires the animal behavior consultant to navigate the complexities of interspecies communication, recognizing that a single approach may not be universally effective. Consultant must consider the species-specific communication repertoire, the context of the interaction, and the potential for misinterpretation by either the animal or the human. Careful judgment is required to select the most appropriate and ethical communication strategy. The correct approach represents best professional practice because it prioritizes a thorough understanding of the individual animal's communication signals within its species-specific context. This aligns with the ethical guidelines of the International Association of Animal Behavior Consultants, IAC, which emphasize evidence-based practices and the welfare of the animal. By observing and interpreting the animal's body language, vocalizations, and other signals, the consultant can build trust and facilitate effective communication, leading to better behavioral outcomes and a stronger human-animal bond. This approach respects the animal as an individual and avoids anthropomorphism, which can lead to misunderstandings and ineffective interventions. An incorrect approach that relies solely on human-centric interpretations of animal behavior is professionally unacceptable. This fails to acknowledge the distinct communication systems of different species and can lead to misinterpreting distress signals as compliance or vice versa, potentially exacerbating behavioral issues and compromising animal welfare. Such an approach violates the IOP's ethical commitment to understanding animal behavior from the animal's perspective and could be seen as a failure to provide competent consultation. Another incorrect approach that assumes all animals within a species communicate identically is also professionally unacceptable. While species-specific communication patterns exist, individual variation, past experiences, and environmental factors can significantly influence an animal's communication style. Failing to account for this individuality can lead to misdiagnosis and ineffective intervention strategies, again, potentially harming the animal's welfare and undermining the consultant's credibility. This approach demonstrates a lack of nuanced understanding required for effective behavior consultation. The professional decision-making process for similar situations should involve a systematic approach. First, gathering comprehensive information about the animal, its history, and the environment. Second, conducting direct observation of the animal's behavior and communication signals in various contexts. Third, researching and applying knowledge of species-specific communication ethology. Fourth, developing hypotheses about the meaning of the observed signals. Fifth, testing these hypotheses through carefully designed interventions. And finally, continuously evaluating the effectiveness of the communication strategies and adjusting them as needed, always prioritizing the animal's welfare and the client's goals. Question 6. The evaluation methodology shows that when assessing a client's pet, a behavior consultant must consider the multifaceted nature of animal behavior. Which of the following best defines the scope of animal behavior for the purposes of professional consultation according to the International Association of Animal Behavior Consultants framework? Option A. Observable actions, physiological responses, and internal states influenced by genetics, environment, and learning, with a focus on the function and welfare implications of these behaviors. Option B. Primarily observable actions and reactions that can be directly witnessed and measured in a given situation. Option C. Behavior that is solely determined by an animal's innate genetic predispositions, with minimal influence from external factors. Option D. The interpretation of an animal's actions through a human-centric lens, attributing human emotions and intentions to their behavior. The correct answer is A. Observable actions, physiological responses, and internal states influenced by genetics, environment, and learning, with a focus on the function and welfare implications of these behaviors. Explanation. The evaluation methodology shows that understanding the definition and scope of animal behavior is fundamental to the practice of an animal behavior consultant. This scenario is professionally challenging because it requires the consultant to navigate the boundaries between a purely scientific definition of behavior and the practical application of that understanding in a client-centered context. The consultant must consider not only observable actions, but also the underlying motivations, environmental influences, and the welfare of the animal, all within the ethical and regulatory framework of the IOP. The correct approach represents best professional practice because it acknowledges that animal behavior, as defined by the IOP, encompasses a broad spectrum of observable actions, physiological responses, and internal states that are influenced by genetics, environment, and learning. It recognizes that the scope extends to understanding the function of these behaviors, their impact on the animal's welfare, and their implications for human-animal interactions. This holistic perspective aligns with the IOP commitment to evidence-based practices and the promotion of animal welfare, ensuring that interventions are both effective and ethically sound. An incorrect approach that focuses solely on observable actions without considering internal states or environmental context fails to capture the full scope of animal behavior as understood in the field. This can lead to superficial assessments and ineffective interventions, potentially overlooking critical factors contributing to a behavior problem. Ethically, this approach could be seen as a failure to provide comprehensive service, as it limits the understanding of the animal's experience. Another incorrect approach that prioritizes anthropomorphic interpretations over scientific observation and evidence risks misinterpreting an animal's motivations and needs. While empathy is important, relying solely on human-like reasoning can lead to inaccurate diagnoses and inappropriate recommendations, potentially causing harm to the animal or exacerbating the behavior problem. This deviates from the IOP emphasis on objective assessment and evidence-based methodologies. A third incorrect approach that narrowly defines animal behavior as solely a product of genetics, ignoring the significant role of learning and environmental factors, is also professionally unacceptable. This limited view would prevent the consultant from developing effective behavior modification plans, as it would fail to address the modifiable aspects of behavior. It represents a failure to apply the full scope of behavioral science principles. The professional decision-making process for similar situations should involve a commitment to continuous learning, adherence to IOP ethical guidelines, and a systematic approach to assessment. This includes gathering detailed history, observing the animal in its natural environment, considering all potential contributing factors, biological, environmental, social, learned, and formulating interventions based on scientific evidence and the individual needs of the animal and its human caregivers. The consultant must always prioritize the animal's welfare and the integrity of the human-animal bond. Question 7. Operational review demonstrates a client is seeking immediate cessation of a dog's persistent barking at the doorbell, expressing frustration and a desire for a quick solution. The client has inquired about methods that would make the dog stop quickly, hinting at a willingness to use forceful techniques. The consultant must recommend a course of action. Option A. Advise the client to use a remote-controlled citronella collar that sprays the dog when it barks at the doorbell, as this will quickly deter the behavior. Option B. Suggest isolating the dog in a separate room every time the doorbell rings, without any further training or interaction, to prevent the barking from occurring. Option C. Recommend a strict no-reward policy for any attention-seeking barking, including at the doorbell, and ignore the behavior entirely until it ceases. Option D. Implement a comprehensive plan that includes desensitization and counter-conditioning to the doorbell stimulus, coupled with positive reinforcement for calm behavior when the doorbell rings, and management strategies to prevent excessive barking while training is ongoing. The correct answer is D. Implement a comprehensive plan that includes desensitization and counter-conditioning to the doorbell stimulus, coupled with positive reinforcement for calm behavior when the doorbell rings, and management strategies to prevent excessive barking while training is ongoing. Explanation. This scenario presents a common challenge in animal behavior consulting, balancing the client's immediate desire for a quick fix with the ethical and scientifically sound application of behavioral modification techniques. The professional's responsibility is to educate the client on effective, humane, and sustainable methods, which often require patience and consistency. The correct approach prioritizes positive reinforcement and management strategies. This aligns with the core principles of ethical animal behavior consulting, emphasizing the welfare of the animal and the establishment of a strong human-animal bond. Regulatory frameworks and professional guidelines for animal behavior consultants typically advocate for methods that avoid causing fear, pain, or distress. Positive reinforcement is scientifically validated as an effective and humane method for behavior modification, promoting learning through rewarding desired behaviors. Management strategies, such as environmental enrichment and preventing opportunities for the unwanted behavior, are crucial for immediate safety and to support the learning process. This approach represents best professional practice because it is grounded in scientific evidence, ethical considerations for animal welfare, and promotes a collaborative relationship with the client based on understanding and trust. An incorrect approach that relies solely on punishment or aversive techniques is ethically and often legally problematic. Such methods can suppress behavior without addressing the underlying cause, leading to increased anxiety, fear, aggression, or other unintended negative consequences for the animal. This directly violates ethical guidelines that prohibit causing harm or distress. Furthermore, many jurisdictions have regulations or professional standards that restrict or prohibit the use of inhumane training methods. Another incorrect approach that focuses only on isolating the animal or removing the stimulus without implementing positive reinforcement or addressing the animal's needs fails to provide a comprehensive solution. While isolation might temporarily reduce the unwanted behavior, it does not teach the animal alternative, desirable behaviors or address any underlying emotional state. This approach is incomplete and does not foster a positive relationship or long-term behavioral change. The professional decision-making process in such situations should involve 1. Thoroughly assessing the animal's behavior, environment, and the client's capabilities and goals. 2. Educating the client on the principles of animal learning and the rationale behind recommended techniques. 3. Developing a clear, step-by-step behavior modification plan that prioritizes humane and effective methods. 4. Establishing realistic expectations for the client regarding the timeline and effort required. 5. Providing ongoing support and adjusting the plan as needed. Question 8. Regulatory review indicates that when addressing a client's concern about a dog exhibiting persistent avoidance behaviors during walks, a consultant must prioritize understanding the animal's cognitive processes in learning, which approach best aligns with the ethical and scientific standards for animal behavior consultants. Option A. Recommend a widely published, generic obedience training program that has shown some success with other dogs, without specific assessment of this individual dog's learning history or cognitive profile. Option B. Immediately implement a strict leash walking protocol that includes corrections for any hesitation, focusing on overriding the dog's perceived stubbornness. Option C. Advise the client to simply ignore the avoidance behavior and hope the dog eventually gets over it without any structured intervention. Option D. Conduct a thorough behavioral assessment, observing the dog in various contexts, gathering detailed history, and exploring potential underlying motivations, learned associations, and emotional states that influence the avoidance behavior. The correct answer is B. Immediately implement a strict leash walking protocol that includes corrections for any hesitation, focusing on overriding the dog's perceived stubbornness. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an animal behavior consultant to balance the client's immediate desire for a quick fix with the ethical and scientific imperative to employ evidence-based methods that promote genuine understanding and long-term behavioral change in the animal. The client's frustration and potential for misinterpreting subtle cues can lead to pressure for simplistic or punitive solutions, which are often counterproductive and ethically unsound. The consultant must navigate this dynamic while adhering to professional standards that prioritize animal welfare and effective, humane training. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a thorough assessment of the animal's cognitive processes and learning history. This aligns with the IOPT ethical guidelines and commitment to science-based animal behavior consulting. By focusing on understanding why the dog is exhibiting the behavior, e.g., through exploring underlying motivations, emotional states, and learned associations, the consultant can develop a tailored intervention plan that addresses the root cause. This approach fosters a deeper understanding of the animal's learning style and environmental influences, leading to more sustainable and humane solutions. It respects the animal's cognitive abilities and promotes a positive human-animal bond, which are core tenets of professional animal behavior consulting. Incorrect approaches analysis. One incorrect approach fails by immediately implementing aversive techniques. This is a regulatory and ethical failure because it disregards the IOPT emphasis on positive reinforcement and humane treatment. Aversive methods can suppress behavior without addressing the underlying cause, potentially leading to increased anxiety, fear, or aggression, and can damage the human-animal bond. It also fails to consider the animal's cognitive state and learning history, violating principles of applied behavior analysis. Another incorrect approach is to solely rely on the client's anecdotal reports without independent observation or assessment of the animal's cognitive processes. This is an ethical failure, as it abdicates the consultant's responsibility to conduct a comprehensive evaluation. It risks misdiagnosing the problem and recommending ineffective or even harmful interventions based on incomplete information. Professional practice demands an objective assessment of the animal's behavior and cognitive functioning. A third incorrect approach involves recommending a generic, one-size-fits-all training program without considering the individual animal's learning style, breed predispositions, or past experiences. This is an ethical and professional failing because it neglects the fundamental principle of individualized assessment and intervention. It demonstrates a lack of understanding of cognitive processes in learning, which are highly variable among individuals. Such an approach is unlikely to be effective and may even exacerbate the problem. Professional reasoning. Professionals should approach such situations by first establishing a clear understanding of the client's concerns and goals. This is followed by a comprehensive assessment of the animal, which includes direct observation, gathering detailed history, and evaluating the animal's cognitive and emotional state. The consultant then uses this information to formulate a hypothesis about the underlying causes of the behavior, considering the animal's learning history and cognitive processes. Intervention plans are developed based on evidence-based, humane methods, with a strong emphasis on positive reinforcement and management strategies. Ongoing assessment and adjustment of the plan are crucial, with clear communication and education provided to the client throughout the process. Question 9. The evaluation methodology shows a tendency to rely on owner-reported frequency of behaviors without direct observation or the use of standardized behavioral checklists. Which approach to data collection and analysis best aligns with ethical and effective behavior assessment practices? Option A. Primarily relying on owner narratives to build a comprehensive picture of the animal's behavior, as owners are the primary caregivers and have the most consistent exposure. Option B. Focusing exclusively on physiological measurements such as heart rate and cortisol levels to objectively assess the animal's stress response during interactions. Option C. Implementing a series of controlled experiments designed to elicit specific problem behaviors, regardless of potential stress to the animal, to gather definitive data. Option D. Supplementing owner reports with direct, systematic observation of the animal in its natural environment and utilizing validated behavioral checklists to quantify specific behaviors. The correct answer is D. Supplementing owner reports with direct, systematic observation of the animal in its natural environment and utilizing validated behavioral checklists to quantify specific behaviors. Explanation. The evaluation methodology shows a common challenge in behavior assessment, balancing the need for comprehensive data with the practical limitations of time, resources, and the animal's welfare. Professionals must select data collection methods that are both informative and ethically sound, minimizing stress to the animal while yielding reliable insights. This requires a deep understanding of the animal's species-specific behavior, individual history, and the context of the assessment. The correct approach represents best professional practice by prioritizing non-invasive, observation-based methods that capture natural behaviors in a controlled yet relevant environment. This aligns with the IOP ethical guidelines, which emphasize minimizing harm and distress to animals by focusing on observable behaviors and avoiding methods that could induce fear or anxiety. The professional ensures the data collected is representative of the animal's typical state and not a reaction to the assessment process itself. This approach also supports the development of effective, humane behavior modification plans based on accurate, ethically gathered information. An incorrect approach that relies heavily on intrusive or stressful stimuli, such as prolonged restraint or the introduction of novel, potentially frightening objects without careful acclimatization, fails to meet ethical standards. Such methods can compromise the validity of the data by eliciting fear-based responses that are not indicative of the animal's underlying behavioral issues. This could lead to misdiagnosis and the implementation of inappropriate interventions, potentially exacerbating the problem. Furthermore, it violates the principle of do no harm and could result in a complaint to the IOP for unethical practice. Another incorrect approach might involve relying solely on owner reports without direct observation. While owner reports are valuable, they are subjective and can be influenced by the owner's perception, emotional state, or understanding of behavior. This can lead to incomplete or biased data, hindering accurate assessment. Ethically, professionals have a responsibility to gather objective data to supplement subjective reports, ensuring a comprehensive understanding of the behavior. The professional decision-making process for similar situations should involve a systematic evaluation of potential data collection methods. This includes considering the species, age, health status, and known history of the animal. The potential for stress or harm associated with each method must be weighed against the potential benefit of the data obtained. Prioritizing methods that are least likely to cause distress, are species appropriate, and yield objective, observable data is paramount. Professionals should always be prepared to adapt their methodology based on the animal's responses during the assessment, ensuring the animal's welfare remains the highest priority. Question 10. The monitoring system demonstrates a consistent pattern of increased vocalization and mild object manipulation in a juvenile canine, which deviates slightly from the expected developmental norms for its age and breed. The consultant must determine the most appropriate next step. Option A. Recommend a comprehensive veterinary examination to rule out any underlying medical conditions contributing to the behavioral changes, followed by a detailed behavioral assessment to evaluate environmental factors and developmental appropriateness of the observed behaviors. Option B. Recommend aversive training methods to quickly suppress the vocalizations and object manipulation, as these behaviors are undesirable and could escalate if not addressed forcefully. Option C. Suggest the owner consult online forums and social media groups for advice from other pet owners experiencing similar issues, and to try popular, unverified training techniques found there. Option D. Advise the owner to immediately implement a strict routine and ignore the vocalizations, assuming it is a phase the puppy will outgrow without further intervention. The correct answer is A. Recommend a comprehensive veterinary examination to rule out any underlying medical conditions contributing to the behavioral changes, followed by a detailed behavioral assessment to evaluate environmental factors and developmental appropriateness of the observed behaviors. Explanation: this scenario presents a professional challenge because it requires the behavior consultant to interpret subtle behavioral shifts in a young animal and determine the most appropriate intervention strategy. The challenge lies in distinguishing between normal developmental variations and potential indicators of underlying issues that could impact long-term well-being and behavior. Careful judgment is required to avoid over-intervention, which can be detrimental, or under-intervention, which could allow a problem to escalate. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment of the animal's developmental trajectory. This involves considering the animal's age, breed predispositions, environmental context, and the specific nature of the observed behaviors. By gathering detailed information and consulting with relevant professionals, the consultant ensures that any intervention is tailored to the individual animal's needs and is aligned with established principles of animal behavior development. This aligns with the ethical obligation to act in the best interest of the animal and to practice within the scope of one's expertise, as outlined by the IOP Code of Ethics. An incorrect approach that focuses solely on immediate suppression of the observed behavior without understanding its developmental context would be a regulatory and ethical failure. This would disregard the principles of ethical animal care and behavior modification, which emphasize understanding the root cause of behavior rather than merely managing symptoms. Such an approach could lead to unintended negative consequences, such as masking underlying issues or creating new behavioral problems. Another incorrect approach that relies on anecdotal advice or unverified training methods would also constitute a regulatory and ethical failure. The IOP Code of Ethics emphasizes the importance of using science-based methods and maintaining professional competence. Relying on unqualified sources or unproven techniques violates this principle and could result in ineffective or harmful interventions, potentially leading to a breach of professional standards. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review all available data, including the monitoring system's output, the animal's history, and environmental factors. 2. Consider the animal's developmental stage and typical behavioral milestones for its species and breed. 3. Formulate hypotheses about the potential causes of the observed behaviors, distinguishing between normal development and potential concerns. 4. Consult with other qualified professionals, e.g., veterinarians, other certified behavior consultants, if the situation warrants it or falls outside the consultant's specific expertise. 5. Develop a plan that is based on scientific principles, is tailored to the individual animal, and prioritizes the animal's welfare. 6. Continuously monitor the effectiveness of the intervention and adjust the plan as needed. Question 11. Implementation of a comprehensive behavioral assessment for a client's dog exhibiting concerning behaviors requires the animal behavior consultant to gather information. Which of the following methods best aligns with IOP ethical guidelines and best practices for objective behavioral observation? Option A. Accepting the client's narrative of the dog's behaviors at face value, as the client is the primary observer in the home environment. Option B. Relying primarily on detailed, structured observation protocols that record frequency, duration, and context of specific behaviors, supplemented by client-provided factual accounts of events. Option C. Utilizing a broad questionnaire that asks the client to describe the dog's personality and emotional state in general terms. Option D. Focusing solely on immediate interventions to suppress the most problematic behaviors, as reported by the client, without extensive prior observation. The correct answer is B. Relying primarily on detailed, structured observation protocols that record frequency, duration, and context of specific behaviors, supplemented by client-provided factual accounts of events. Explanation. This scenario presents a professional challenge because the animal behavior consultant must balance the client's immediate desire for a quick fix with the ethical and regulatory imperative to conduct thorough, objective behavioral observation. The client's emotional investment in their pet can lead to biased reporting and a desire to interpret observations in a way that confirms their pre-existing beliefs about the animal's behavior. The consultant's role is to provide evidence-based guidance, which requires rigorous data collection that is free from subjective interpretation or anecdotal evidence. The correct approach represents best professional practice because it prioritizes systematic, objective data collection methods that are foundational to evidence-based animal behavior consulting. This aligns with the IOP commitment to scientific principles and ethical practice, ensuring that interventions are based on reliable observations rather than assumptions or client-driven narratives. By employing structured observation protocols, the consultant can gather quantifiable data on frequency, duration, and intensity of behaviors, allowing for accurate assessment and the development of effective, tailored behavior modification plans. This adherence to scientific rigor is implicitly supported by the IOP emphasis on professional competence and ethical conduct, which necessitates the use of validated observational techniques. An incorrect approach that relies solely on the client's anecdotal reports fails to meet professional standards. This is an ethical failure because it compromises the objectivity of the assessment, potentially leading to misdiagnosis and ineffective or even harmful interventions. It also violates the implicit expectation of professional expertise, where the consultant's role is to provide an objective evaluation, not simply to validate the client's perceptions. Another incorrect approach that focuses on immediate symptom reduction without understanding the underlying behavioral drivers is also problematic. This is an ethical failure as it may lead to superficial improvements that do not address the root cause of the behavior, potentially exacerbating the issue in the long term or leading to the development of new, problematic behaviors. It also demonstrates a lack of professional due diligence in conducting a comprehensive behavioral assessment. Professionals should approach similar situations by first establishing clear communication protocols with the client regarding the importance of objective observation and the limitations of anecdotal evidence. They should then implement a structured observation plan, which may include direct observation by the consultant, video recordings, and carefully designed questionnaires that prompt specific, observable details rather than subjective interpretations. The decision-making process should always prioritize data integrity and scientific validity, ensuring that all recommendations are grounded in reliable behavioral data. Question 12. The risk matrix shows a moderate likelihood of a dog exhibiting resource guarding behaviors, specifically growling and snapping at other household dogs when near high-value food items. The owner is concerned about potential escalation and interdog aggression. Considering behavioral ecology and evolutionary perspectives, what is the most ethically sound and professionally responsible approach for an IOP-certified animal behavior consultant? Option A. Recommend that the owner implement a strict dominance-based training regimen to establish clear pack hierarchy and deter the dog from guarding resources. Option B. Advise the owner to immediately remove all high-value food items from the environment and only feed the dogs separately in isolated rooms to eliminate the trigger for the guarding behavior. Option C. Suggest that the owner consider reharming the dog to a single-dog household where resource guarding will not be an issue. Option D. Develop a comprehensive management and training plan that includes preventing access to high-value items when all dogs are present, gradually desensitizing and counter-conditioning the dog to the presence of other dogs near food, and teaching alternative behaviors like leave it or trade. Correct answer is D. Develop a comprehensive management and training plan that includes preventing access to high-value items when all dogs are present, gradually desensitizing and counter-conditioning the dog to the presence of other dogs near food, and teaching alternative behaviors like leave it or trade. Explanation. This scenario presents a professional challenge because it requires balancing the immediate welfare of an animal with the long-term implications of its behavior, informed by behavioral ecology and evolutionary principles. The consultant must navigate potential client expectations, the animal's intrinsic motivations, and the ethical imperative to avoid causing undue stress or harm. Careful judgment is required to ensure interventions are both effective and ethically sound, aligning with the IOP commitment to science-based, humane animal behavior consulting. Correct approach represents best professional practice because it prioritizes understanding the underlying evolutionary drivers of the dog's behavior. By considering the dog's breed-specific predispositions and the ecological context of its actions, e.g., resource guarding in a multi-dog household, the consultant can develop a management and training plan that addresses the root cause rather than just suppressing the symptom. This aligns with the IOP ethical guidelines, which emphasize using humane, science-based methods that respect the animal's natural behaviors and motivations. Focusing on management to prevent the behavior and gradual desensitization/counter-conditioning, informed by the dog's evolutionary history, is a hallmark of ethical and effective behavior modification. An incorrect approach that focuses solely on immediate suppression of the behavior without understanding its ecological or evolutionary basis would be ethically flawed. For instance, using aversive techniques to stop the growling would likely increase the dog's anxiety and potentially lead to more severe behavioral issues, such as biting, without addressing the underlying resource guarding instinct. This violates the IOP ethical principles of avoiding harm and using positive reinforcement-based methods. Another incorrect approach might be to dismiss the behavior as simply bad or stubborn, without considering the evolutionary pressures that may have shaped such a response in canids. This demonstrates a lack of scientific understanding and a failure to apply behavioral ecology principles, leading to ineffective and potentially harmful interventions. A third incorrect approach could be to recommend reharming the dog without a thorough assessment and intervention attempt, failing to uphold the professional responsibility to explore all humane options for behavior modification first. Professionals should employ a decision-making framework that begins with a thorough assessment of the behavior within its ecological and evolutionary context. This involves gathering detailed history, observing the animal in its environment, and considering breed-specific predispositions. The next step is to identify the function of the behavior, understanding what the animal is trying to achieve or avoid. Based on this understanding, interventions should be designed using humane, science-based methods that address the underlying motivations and promote well-being. This includes management strategies to prevent rehearsal of the unwanted behavior and training techniques that build alternative, desirable behaviors. Throughout the process, ongoing assessment and adjustment of the plan are crucial, always prioritizing the animal's welfare and adhering to professional ethical standards. Question 13. Governance review demonstrates that an animal behavior consultant is developing a behavior modification plan for a domestic dog exhibiting complex social anxieties. The consultant is considering how research on social learning and group dynamics in non-human primates might offer insights into the dog's behavior. Which of the following approach is best reflects the responsible and ethical application of comparative psychology in this scenario. Adhering to IOP guidelines. Option A. Consulting peer-reviewed studies on social cognition and learning in various primate species to identify potential parallels and differences in behavioral mechanisms that might inform the understanding of the dog's anxieties, while acknowledging species-specific adaptations. Option B. Applying principles of social learning observed in primate hierarchies directly to the dog's interactions with its human family, assuming identical social structures and motivations. Option C. Prioritizing anecdotal client reports and popular training methods over any scientific literature, including comparative psychology, to ensure immediate client satisfaction. Option D. Focusing exclusively on the dog's immediate environment and observable behaviors without exploring potential evolutionary or cross-species influences on its social anxieties. The correct answer is B. Applying principles of social learning observed in primate hierarchies directly to the dog's interactions with its human family, assuming identical social structures and motivations. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires an animal behavior consultant to integrate knowledge from comparative psychology into their practice, while adhering to the ethical and professional standards set by the International Association of Animal Behavior Consultants, IOP. The challenge lies in discerning how to apply principles derived from studying diverse animal species to a specific client case without overgeneralizing or misinterpreting findings, ensuring the advice provided is scientifically sound, ethically responsible, and client-centered. Correct approach analysis. The correct approach represents best professional practice because it directly aligns with the IOP commitment to evidence-based practice and the ethical application of scientific knowledge. By considering how research on social learning in primates might inform understanding of a dog's learned behaviors, the consultant is engaging in a scientifically rigorous and relevant application of comparative psychology. This demonstrates a commitment to understanding the underlying mechanisms of behavior across species, which can lead to more nuanced and effective behavior modification plans. This approach respects the complexity of animal cognition and learning, avoiding simplistic or anthropomorphic interpretations. Incorrect approaches analysis. One incorrect approach fails by solely relying on anecdotal evidence or popular opinion regarding animal behavior. This violates the IOP emphasis on evidence-based practice and can lead to ineffective or even harmful interventions. It bypasses the critical analysis of scientific literature, including comparative psychology, which is essential for informed decision-making. Another incorrect approach involves applying findings from one species directly to another without considering significant biological or ecological differences. For instance, assuming a behavior observed in a solitary predator is directly transferable to a highly social prey species without careful consideration of the differing evolutionary pressures and social structures would be a significant ethical and scientific failing. This demonstrates a lack of critical evaluation and a potential for misapplication of comparative data, which could result in inappropriate recommendations for the client. A third incorrect approach might involve dismissing comparative psychology entirely, focusing only on the immediate presenting problem without exploring potential underlying mechanisms or broader behavioral contexts. This limits the consultant's ability to provide comprehensive and insightful guidance, potentially overlooking crucial factors that contribute to the animal's behavior and failing to leverage the full spectrum of scientific understanding available. Professional reasoning. Professionals should approach client cases by first gathering a thorough history and observing the animal's behavior. They should then critically evaluate relevant scientific literature, including research from comparative psychology, to understand potential underlying mechanisms and species-specific considerations. This knowledge should be synthesized with the specific context of the client's situation, leading to the development of a behavior modification plan that is evidence-based, ethically sound, and tailored to the individual animal and its environment. Continuous learning and a commitment to scientific integrity are paramount. Question 14. The control framework reveals that a client reports their dog is exhibiting increased reactivity towards visitors. The dog has a history of being generally friendly, but has recently become more vocal and tense when people enter the home. The client is seeking a quick solution to stop the barking and lunging, which approach best aligns with the principles of animal behavior risk assessment and ethical consulting. Option A. Advise the client to use a bark collar to immediately suppress the vocalizations, as this will deter the dog from reacting. Option B. Suggest the client administer a mild sedative to the dog before visitors arrive, as this will calm the dog and prevent any outward signs of reactivity. Option C. Focus solely on teaching the dog a quiet command, as this directly addresses the barking behavior the client finds most problematic. Option D. Immediately implement a desensitization and counter-conditioning protocol targeting visitor presence, while also recommending management strategies to prevent exposure. The correct answer is D. Immediately implement a desensitization and counter-conditioning protocol targeting visitor presence, while also recommending management strategies to prevent exposure. Explanation. This scenario is professionally challenging because it requires the behavior consultant to balance the immediate need for intervention with a thorough understanding of the animal's underlying motivations and environmental influences. Superficial assessment risks misdiagnosing the problem, leading to ineffective or even harmful interventions. The consultant must also consider the client's capacity and willingness to implement recommendations, as well as the potential impact on the human-animal bond. The correct approach represents best professional practice because it prioritizes a comprehensive risk assessment that considers multiple factors contributing to the behavior. This aligns with the ethical guidelines of the International Association of Animal Behavior Consultants, IABC, which emphasize evidence-based practices and the welfare of the animal. A systematic approach, starting with ruling out medical causes and then thoroughly evaluating environmental and behavioral factors, ensures that interventions are targeted and effective. This also demonstrates a commitment to professional integrity by avoiding assumptions and relying on data-driven conclusions. An incorrect approach that focuses solely on immediate symptom suppression without investigating the root cause fails to address the underlying issues. This can lead to the behavior re-emerging or manifesting in different, potentially more problematic ways. Ethically, this is a failure to provide competent service and uphold the principle of do no harm. Another incorrect approach that relies on anecdotal evidence or unverified training methods bypasses the scientific principles of animal behavior and IABC commitment to evidence-based practice. This can result in ineffective or even detrimental outcomes for the animal and client, and represents a failure to maintain professional competence. An approach that prioritizes client convenience over the animal's welfare, for example, by recommending a quick fix that causes distress to the animal, is a direct violation of ethical obligations to the animal. Professionals should use a decision-making framework that begins with a thorough history intake, followed by direct observation of the animal in its environment. This should be coupled with a differential diagnosis process, considering medical, environmental, and behavioral factors. Collaboration with veterinary professionals is crucial when medical issues are suspected. Interventions should be based on scientific principles and tailored to the individual animal and its circumstances, with ongoing assessment and adjustment of the plan. Question 15. Investigation of a 10-week-old Labrador Retriever puppy exhibiting mouthing, nipping, and occasional jumping on its new owners, who are concerned it is a sign of aggression. What is the most appropriate initial approach for an IABC-certified animal behavior consultant? Option A. Interpret the puppy's behaviors as definitive signs of future aggression and suggest immediate reharming to prevent potential danger. Option B. Immediately recommend a veterinary behaviorist consultation to rule out early onset aggression due to the puppy's perceived aggressive behaviors. Option C. Advise the owners to strictly punish all mouthing and jumping behaviors with aversive methods to quickly suppress them. Option D. Assess the puppy's behavior within the context of normal canine developmental milestones for its age, considering typical play behaviors and socialization periods, and educate the owners on these developmental stages and appropriate management strategies. The correct answer is D. Assess the puppy's behavior within the context of normal canine developmental milestones for its age, considering typical play behaviors and socialization periods, and educate the owners on these developmental stages and appropriate management strategies. Explanation. This scenario presents a professional challenge due to the inherent variability in developmental milestones across different species and even within breeds of the same species. A behavior consultant must navigate this complexity while adhering to the IOPT ethical guidelines, which emphasize evidence-based practice and client education. The core of the challenge lies in accurately assessing a young animal's behavior within the context of its species-specific developmental stage, avoiding premature or inaccurate diagnoses, and providing appropriate guidance to the owner. The correct approach represents best professional practice because it prioritizes a thorough, species-appropriate developmental assessment before considering any diagnostic labels or intervention strategies. This aligns with IOPT principles of using scientific literature and understanding species-specific behavior. By focusing on the animal's current developmental stage and its implications for behavior, the consultant can provide accurate, tailored advice that empowers the owner and promotes the animal's well-being. This approach avoids anthropomorphism and premature conclusions, which are ethically problematic and can lead to ineffective or harmful interventions. An incorrect approach that immediately labels a young animal's behavior as a disorder without considering its developmental stage is a significant ethical failure. This violates the principle of evidence-based practice by jumping to conclusions without sufficient data and understanding of normal developmental trajectories. It can lead to misdiagnosis, unnecessary stress for the animal and owner, and potentially inappropriate or harmful interventions. Furthermore, it fails to educate the client about normal development, which is a crucial aspect of responsible behavior consultation. Another incorrect approach that relies solely on anecdotal evidence or generalized puppy behavior without species-specific research is also professionally unacceptable. While anecdotal observations can be a starting point, they are not a substitute for scientific understanding. IOPT standards require consultants to base their recommendations on current scientific knowledge. Failing to do so can result in advice that is not only ineffective, but also potentially detrimental to the animal's development and the human-animal bond. The professional decision-making process for similar situations should involve a systematic approach. 1. Gather comprehensive history from the owner, including details about the animal's age, breed, environment, and specific behaviors observed. 2. Conduct a thorough observation of the animal in its natural environment, if possible, or through detailed descriptions and video evidence. 3. Research and consult species-specific literature on normal developmental milestones, including critical socialization periods, fear periods, and typical behavioral expressions at different ages. 4. Compare the observed behaviors to established species-specific developmental norms, considering breed predispositions where relevant. 5. Formulate a hypothesis about the behavior, always considering developmental factors as primary explanations before considering pathology. 6. Educate the owner about normal development and the likely reasons for the observed behaviors, setting realistic expectations. 7. Develop an intervention plan that is tailored to the animal's developmental stage and addresses the underlying causes of the behavior, prioritizing positive reinforcement and humane methods. Question 16. What factors determine the most appropriate naturalistic observation techniques for assessing a client's dog's reactivity towards strangers in a home environment, considering both data accuracy and animal welfare? Option A. The owner's preference for immediate results and the perceived urgency of the reactivity issue. Option B. The availability of advanced recording equipment and the observer's personal comfort level with the dog. Option C. The breed of the dog and the historical prevalence of reactivity within that breed. Option D. The dog's individual temperament, the specific triggers for reactivity, the physical layout of the home, and the observer's ability to remain unobtrusive. The correct answer is D. The dog's individual temperament, the specific triggers for reactivity, the physical layout of the home, and the observer's ability to remain unobtrusive. Explanation. Scenario analysis. This scenario is professionally challenging because the consultant must balance the need for objective data collection with the ethical imperative to minimize disturbance to the animal and its environment. Naturalistic observation, by its nature, involves observing behavior in the animal's natural setting, which can be sensitive to human presence. The consultant's actions can inadvertently alter the very behaviors they are trying to study, leading to inaccurate data and potentially causing stress to the animal. This requires careful consideration of the observation methods chosen and their potential impact. Correct approach analysis. The correct approach prioritizes the welfare of the animal and the integrity of the data by employing methods that are least likely to interfere with natural behavior. This aligns with the IOP ethical guidelines, which emphasize minimizing harm and distress to animals. Using non-intrusive techniques, such as remote cameras or observing from a significant distance, allows for the collection of data that is more representative of the animal's typical behavior. This approach upholds the professional standard of conducting research and assessments in a manner that respects the animal's autonomy and well-being, which is a cornerstone of ethical animal behavior consulting. Incorrect approaches analysis. One incorrect approach involves direct, close proximity observation without prior habituation. This is ethically problematic as it can cause significant stress and fear in the animal, leading to abnormal behavior or avoidance, thus compromising data validity. Violates the principle of minimizing harm. Another incorrect approach is to rely solely on owner reports without direct observation. While owner reports are valuable, they are subjective and can be influenced by the owner's perception, biases, or incomplete observation. This approach fails to gather objective, naturalistic data, which is crucial for accurate behavior assessment and intervention planning, potentially leading to misdiagnosis or ineffective strategies. A third incorrect approach is to use highly stimulating or aversive methods to elicit specific behaviors for observation. This directly contradicts ethical guidelines that prohibit causing distress or harm to animals for the purpose of observation. Such methods would not only yield data on abnormal or stress-induced behaviors, but would also be a clear violation of professional conduct and animal welfare standards. Professional reasoning. Professionals should adopt a decision-making process that begins with a thorough risk assessment of potential observation methods on the specific animal and its environment. This involves considering the species, individual temperament, the context of the observation, and the potential for habituation. The primary goal is to select methods that maximize data accuracy while minimizing any negative impact on the animal's welfare. This iterative process of observation, assessment, and adjustment, guided by ethical principles and scientific rigor, ensures that the consultant acts in the best interest of the animal and provides reliable, evidence-based advice. Question 17. When evaluating a dog exhibiting destructive chewing behavior, what is the most appropriate initial step in a functional assessment according to IOP guidelines? Option A. Rely solely on the owner's description of the behavior and their belief that the dog is seeking attention. Option B. Systematically observe the dog's environment and behavior patterns, noting specific times, locations, and triggers for the chewing, as well as the consequences that follow. Option C. Immediately recommend a variety of chew toys and puzzle feeders, assuming the behavior is due to boredom. Option D. Advise the owner to confine the dog to a crate for extended periods to prevent access to items for chewing. The correct answer is B. Systematically observe the dog's environment and behavior patterns, noting specific times, locations, and triggers for the chewing, as well as the consequences that follow. Explanation. This scenario presents a common challenge in animal behavior consulting, balancing the owner's perception of a problem with the objective data gathered during a functional assessment. The professional must navigate potential owner bias, emotional attachment, and differing interpretations of behavior while adhering to ethical guidelines and best practices for animal welfare. The core of the challenge lies in translating observable behaviors and environmental factors into a scientifically sound understanding of the underlying function, which then informs an effective intervention plan. The correct approach represents best professional practice because it prioritizes a systematic, data-driven methodology. A thorough functional assessment, which involves detailed observation, history-taking, and environmental analysis, is the cornerstone of ethical and effective behavior modification. This approach aligns with the IOP commitment to science-based methods and animal welfare by ensuring that interventions are tailored to the specific needs and motivations of the animal, rather than relying on assumptions or anecdotal evidence. It also upholds professional integrity by demonstrating a commitment to objective analysis and evidence-based practice, which is implicitly required by the IOP ethical code regarding competence and responsible practice. An incorrect approach that focuses solely on the owner's subjective description of the behavior without independent verification fails to meet professional standards. This approach risks misinterpreting the behavior's function, leading to ineffective or even harmful interventions. Ethically, it violates the principle of acting in the best interest of the animal, as the plan would be based on incomplete or inaccurate information. It also demonstrates a lack of competence in conducting a proper functional assessment, a core skill for an IOB-certified professional. Another incorrect approach that relies on generalized advice or common-sense solutions without a specific assessment of the individual animal and its environment is also professionally unacceptable. This demonstrates a failure to apply specialized knowledge and skills, a breach of ethical responsibility. It overlooks the unique context of each case and can lead to interventions that are not only ineffective, but may also exacerbate the problem or cause distress to the animal. This approach disregards the scientific basis of behavior analysis and the IOP emphasis on individualized, evidence-based interventions. The professional decision-making process for similar situations should involve a structured approach. 1. Information gathering. Collect comprehensive data from multiple sources, including owner reports, direct observation, and environmental assessment. 2. Hypothesis generation. Formulate plausible hypotheses about the function of the behavior based on the gathered data. 3. Data analysis. Systematically analyze the data to identify patterns, antecedents, and consequences related to the behavior. 4. Intervention planning. Develop an intervention plan based on the most likely functional hypothesis, prioritizing humane and effective strategies. 5. Monitoring and adjustment. Continuously monitor the effectiveness of the intervention and adjust the plan as needed based on ongoing data collection. This process ensures that decisions are grounded in objective evidence and ethical considerations, leading to the best possible outcomes for the animal. Question 18. System analysis indicates that a client reports their dog has recently begun exhibiting increased vocalization and destructive chewing when left alone. The client is seeking immediate solutions for these behaviors. What is the most appropriate initial step for an animal behavior consultant to take? Option A. Advise the owner to use aversive training methods to deter the unwanted behaviors. Option B. Rely solely on the owner's description of the behaviors to create a behavior modification plan. Option C. Immediately implement a desensitization and counter-conditioning protocol for separation anxiety. Option D. Recommend a comprehensive veterinary examination to rule out any underlying medical conditions that could be contributing to the behavior. The correct answer is D. Recommend a comprehensive veterinary examination to rule out any underlying medical conditions that could be contributing to the behavior. Explanation. Scenario analysis. This scenario presents a common challenge in animal behavior consulting, distinguishing between a learned behavior and a behavior rooted in an underlying medical or physiological issue. Failing to accurately assess the root cause can lead to ineffective or even harmful interventions, potentially exacerbating the animal's distress or condition. The professional challenge lies in the consultant's responsibility to employ a systematic and evidence-based approach that prioritizes the animal's welfare and adheres to professional standards of practice. Correct approach analysis. The correct approach prioritizes a comprehensive assessment that includes ruling out medical causes before implementing behavioral modification techniques. This aligns with the ethical imperative of do no harm and the IOP emphasis on evidence-based practice. By recommending a veterinary examination, the consultant ensures that any underlying physical discomfort, pain, or illness that could be contributing to the observed behaviors is identified and addressed. This is a foundational step in responsible animal behavior consulting, as behavioral interventions are unlikely to be successful if a medical issue is present and untreated. This approach also reflects a commitment to interdisciplinary collaboration, recognizing the veterinarian's role in diagnosing and treating medical conditions. Incorrect approaches analysis. One incorrect approach involves immediately implementing aversive training techniques without a thorough assessment. This is ethically problematic as it risks punishing an animal for behavior that may be a symptom of pain or illness, leading to increased fear, anxiety, and potential aggression. It violates the principle of humane treatment and fails to address the root cause. Furthermore, it demonstrates a lack of professional due diligence by not considering all potential contributing factors. Another incorrect approach is to solely rely on observation and anecdotal evidence from the owner to develop a behavior modification plan, ignoring the possibility of medical influence. While owner reports are valuable, they are not a substitute for professional assessment. This approach risks misdiagnosing the problem and applying inappropriate interventions, which can be ineffective and detrimental to the animal's welfare. It also bypasses the crucial step of veterinary consultation, which is a cornerstone of responsible practice. Third incorrect approach is to dismiss the owner's concerns as simply a training issue and refuse to engage further without a veterinary referral. While a veterinary referral is important, a complete refusal to engage without it can be seen as a lack of professional responsibility and a failure to provide initial guidance. A skilled consultant should be able to gather initial information and advise on the importance of a veterinary checkup as part of the assessment process, rather than outright refusing consultation. Professional reasoning. Professionals should utilize a decision-making framework that begins with a thorough history intake, followed by direct observation of the animal in its environment. Crucially, this framework must include a strong recommendation for veterinary consultation to rule out medical etiologies for behavioral changes. Only after medical causes have been addressed or ruled out should behavior modification plans be developed and implemented. This systematic approach ensures that the animal's welfare is prioritized and that interventions are targeted and effective. Professionals must also be aware of their scope of practice and collaborate effectively with other animal health professionals. Question 19. Stakeholder feedback indicates a client is seeking consultation for their dog's sudden onset of aggression, firmly believing the behavior is solely due to a specific breed's inherent genetic predisposition, despite the client also reporting recent significant changes in the household environment. As an animal behavior consultant, how should you prioritize your initial risk assessment to best address this complex behavioral issue? Option A. Conduct a comprehensive risk assessment that thoroughly investigates both potential genetic predispositions and all environmental factors, including recent changes, to understand the multifactorial nature of the aggression. Option B. Focus exclusively on identifying genetic markers associated with aggression in the dog's breed, as this is the client's primary concern and stated cause of the behavior. Option C. Immediately dismiss the client's genetic theory and focus solely on environmental stressors, as environmental factors are generally considered more malleable than genetics. Option D. Rely on anecdotal evidence and common breed stereotypes to inform the assessment, as this often reflects practical experience with similar cases. Correct answer is A. Conduct a comprehensive risk assessment that thoroughly investigates both potential genetic predispositions and all environmental factors, including recent changes, to understand the multifactorial nature of the aggression. Explanation. This scenario presents a professional challenge because it requires an animal behavior consultant, ABC, to navigate the complex interplay of genetics and environment in a client's animal's behavior, while also managing client expectations and adhering to professional standards. The client's strong belief in a purely genetic cause for their pet's aggression, despite observable environmental triggers, necessitates a delicate approach that educates without alienating. Careful judgment is required to balance scientific understanding with practical application and client communication. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based risk assessment that considers both genetic predispositions and environmental influences. This aligns with the ethical guidelines of the International Association of Animal Behavior Consultants, IABC, which emphasize the importance of understanding the multifactorial nature of behavior and the need for individualized assessment. By conducting a thorough risk assessment, the ABC can identify all contributing factors to the aggression, develop a tailored intervention plan, and provide accurate prognosis and safety recommendations to the client. This approach is client-centered, prioritizing the well-being of both the animal and the people involved, and upholds the professional integrity of the ABC. An incorrect approach that focuses solely on genetics fails to acknowledge the significant role of environmental factors in shaping behavior. This is an ethical failure, as it provides an incomplete and potentially misleading assessment, which could lead to ineffective or even harmful interventions. It also fails to meet the professional standard of comprehensive behavioral analysis. Another incorrect approach that dismisses genetics entirely and attributes all behavior to environment is also an ethical and professional failure. While environment is crucial, ignoring potential genetic predispositions can lead to overlooking important contributing factors and developing an inadequate behavior modification plan. This approach is not scientifically sound and can result in a failure to adequately address the root causes of the behavior. A third incorrect approach that relies solely on anecdotal evidence or popular opinion, without a systematic risk assessment is a significant professional and ethical failure. This demonstrates a lack of scientific rigor and a disregard for established principles of animal behavior. It can lead to misdiagnosis, inappropriate recommendations, and a failure to ensure client and public safety, all of which are serious breaches of professional conduct. The professional decision-making process for similar situations should involve a systematic approach. 1. Active listening and empathy. Understand the client's perspective and concerns. 2. Comprehensive data gathering. Collect detailed history, observe the animal and its environment, and consider all potential contributing factors: genetics, environment, health, training history. 3. Evidence-based assessment. Apply scientific knowledge and principles to analyze the gathered data. 4. Risk assessment. Evaluate the potential for harm to the animal, client, and others. 5. Collaborative plan development. Work with the client to create a realistic and effective intervention plan. 6. Clear communication. Educate the client about the contributing factors, the rationale behind the plan, and realistic expectations. 7. Ongoing monitoring and adjustment. Regularly assess progress and modify the plan as needed. Question 20. The evaluation methodology shows a behavior consultant observing a dog that exhibits extreme fear and avoidance of strangers, often escalating to lunging and snapping when approached. The consultant is tasked with determining the primary drivers of this behavior to develop an effective intervention plan. Which of the following assessment strategies best aligns with IOP best practices for differentiating between innate predispositions and learned responses in this scenario? Option A. Relying on owner anecdotes about the dog's personality, attributing the behavior to a stubborn or dominant nature without further investigation into specific triggers or learning history. Option B. Implementing aversive training techniques immediately to suppress the lunging and snapping, based on the assumption that the dog is intentionally misbehaving and needs to be corrected. Option C. Prioritizing a thorough review of the dog's genetic background and breed-specific behavioral tendencies, alongside a detailed history of all social interactions and environmental exposures since puppyhood, to identify potential innate factors and learned associations. Option D. Focusing exclusively on the dog's immediate reactions to strangers, assuming the aggressive responses are purely learned behaviors resulting from a lack of proper socialization. The correct answer is C. Prioritizing a thorough review of the dog's genetic background and breed-specific behavioral tendencies, alongside a detailed history of all social interactions and environmental exposures since puppyhood, to identify potential innate factors and learned associations. Explanation. The evaluation methodology shows a scenario where a behavior consultant is assessing a dog exhibiting fear-based aggression. The challenge lies in accurately differentiating between behaviors that are primarily innate, instinctual, genetically predisposed, and those that are learned through experience or conditioning. Misinterpreting this distinction can lead to ineffective or even harmful intervention strategies, potentially exacerbating the problem and violating ethical standards of care. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment that considers multiple contributing factors. This aligns with the IOP commitment to science-based animal behavior consulting, emphasizing the need to understand the underlying causes of behavior before implementing solutions. By systematically evaluating the dog's history, breed predispositions, environmental influences, and learning experiences, the consultant can develop a tailored, humane, and effective behavior modification plan. This approach respects the animal's welfare and upholds the professional standards of the IOP by ensuring interventions are grounded in a thorough understanding of behavior, rather than assumptions. An incorrect approach that focuses solely on the immediate presentation of the behavior without investigating its origins is ethically flawed. It fails to meet the professional obligation to conduct a thorough assessment and may lead to misdiagnosis and inappropriate treatment. For instance, attributing fear-based aggression solely to a learned response without considering potential innate predispositions, e.g., breed-specific fearfulness or anxiety, could result in a plan that doesn't address the root cause, potentially leading to continued suffering for the animal and frustration for the owner. This also risks violating IOP ethical guidelines that mandate a science-based approach and prioritize animal welfare. Another incorrect approach that relies on anecdotal evidence or popular but unsubstantiated theories about innate behaviors without empirical support is also professionally unacceptable. This bypasses the scientific rigor expected of a certified behavior consultant. It can lead to interventions that are not only ineffective, but also potentially detrimental, such as using aversive methods based on a misunderstanding of the behavior's origin. Such practices would contravene the IOPT emphasis on humane and evidence-based methods. The professional decision-making process for similar situations should involve a systematic approach. 1. Gather a detailed history from the owner, including onset triggers and environmental context of the behavior. 2. Observe the behavior in its natural or controlled settings, noting body language and physiological indicators. 3. Consider the animal's species, breed, age, and developmental stage for potential innate predispositions. 4. Evaluate the animal's learning history, including any past training methods, significant life events, or social interactions. 5. Formulate a differential diagnosis, considering both innate and learned components. 6. Develop a behavior modification plan based on the most likely contributing factors, prioritizing humane and evidence-based techniques. 7. Continuously monitor progress and adjust the plan as needed, always with the animal's welfare as the primary concern.